Well, we're now joined by Mohamed Hersi, who's the former chairman of Kenya Tourism Foundation and hotel and tourism expert for the East Africa region. Mohamed has enjoyed an extensive career in tourism, residing over some of the finest hotels in the coast region and safari circuit. His experience has enabled a wide spread of understanding of regional tourism with a focus on quality service delivery and client satisfaction. Mohamed, a very good evening to you. Thank you so much indeed for joining us.
Evening.
All right, so let's talk about how, East Africa generally, Kenya in particular, has always been a great tourism destination for traffic, particularly from Europe and other parts of the world. How badly did COVID-19 disrupt things?
Firstly, thank you for the invite. When it comes to COVID affected the entire world. It is one of the we've ever experienced. I don't think there's any other killer case of COVID was a very bad one. But, looking on the other side, it's not an East African thing or African thing, it's the entire world. So simply put, the whole world has been put on a reset mode. So we all have to rebuild from scratch again. So to answer your question, how have we been affected? Overnight, we lost over 83% of our 2019 figures. And when you look at arrivals of just around less than 300,000 for 2021, that was very low. But again, we believe the worst is behind us, and we're quite optimistic and looking forward as we try to chart the way forward now.
Talking about charting a way forward, what does that look like? We see that Kenya has been spared red list status by the UK, which perhaps is a temporary reprieve, a good reprieve. However, most people travel the region, don't they? So if the other countries are not also getting the same, it becomes a challenge even for Kenya.
You see, the issue of travel restrictions, as Africa, we already had enough challenges when it comes to visa issues and air accessibility. And now that we have COVID, apart from being asked to take a PCR test 96 hours before arrival, with some airlines asking for another PCR before you leave the destination that you visited. These are all challenges we are going to live with. In fact, the way we look at it, it's a moving target. There's never a permanent solution. Even now, as much as we are off the red list in the UK, we still have to wait until the 4th of October for things to be finalized. But on the other hand, people go back to the UK, they're still expected to quarantine. So it is still a lot of work needs to be done. And yes, I agree with you. We cannot be alone as Kenya. We need to see to it that all our neighbors also get out of the red list, because it doesn't help. Because when you look at it, Kenya, we share many tourists these days with Tanzania. We combine with Rwanda and Uganda. And then the largest carrier for us in this region is Ethiopian Airlines. And if Ethiopia is on red list, equally doesn't help us. And when you look at regional tourism as well, that also becomes another challenge on its own. So it's very important that all these restrictions are eventually lifted. But looking forward, we are quite optimistic that, number one, domestic tourism has really helped us. Keep in mind that we had our own share of problems back in 2007, and when we went on full time to campaign and promote domestic tourism under what we called Tembea Kenya, basically travel and see your country. And Kenyans came out in large numbers. And in the process also, we ended up attracting a lot of our neighbors, especially Uganda, a good part of Tanzania as well, and also even Ethiopia, which is purely landlocked. Now, all those put together has really helped us. Then keep in mind also that Nairobi is headquarters of a lot of our diplomatic communities and also a lot of multinational companies. All these ones are also considered as residents, and they've kept us going, because COVID, you need to start domestic first and then move to regional and hopefully start going into international. On the international front, things are also looking up. For the first time, we're seeing good numbers coming from the US, good numbers coming from Canada, and also Europe has quite opened up, especially Germany, France, and apart from UK with the issues we've had, but since the new measures have been put in place, we also believe that the UK market is going to respond well. So we are quite optimistic on what we are seeing currently.
What has Kenya done to attract traffic from its traditional sources, Europe, North America, and other countries?
You see, the main challenge we all face is COVID. One of the key things our government has done, and they've been very transparent, is about sharing data. And every single day at 3 p.m., our Minister for Health will go live on TV to share the number of infections, to share the number of people who are still in hospital, and how many people have recovered and they're now back home. I think that transparency has helped us a great deal. And then number two, specifically when it comes to UK were very keen on what they call genome sequence testing. That has also happened. We invested a lot of money to do that. And in the process, now we are giving a lot of data to all these countries, specifically the UK. And I think based on all those factors and many things that we've been doing, they've been able to take us off the list. But another major thing that we have done is to put tourism players on the front line when it comes to vaccination. We are not there yet. Less than 10% of our population have been vaccinated, but we've given a priority to players. I'll tell you, almost all the hotels, classified hotels, we are now sitting on almost 80% of the staff who have been vaccinated. Tour companies, some of them are 100% vaccinated their driver guides. And this is the sort of stuff that any traditional source market, whether it's North America, whether it is Europe, they would like to see and they would like to hear about it. So basically, right from the airline, the airport, the immigrations, the hotel, the tour company, all these people who are going to handle you have all been vaccinated. So basically, simply put, we're giving you a bubble, which is the right thing to do. That is the easiest way for us to give any reassurance that will be visitor. And you'll not be surprised. Many of the hotels, many of the tour companies nowadays, you'll see members are wearing a badge that says, I am fine, I care. When people see such things, our airport as well, we've taken a lot of measures. All those things count for something. It may have taken a long time, but confidence is coming in and it's coming back, and hopefully we should be able to say, you know what, we start recovering. So second half of the year has been looking strong, and especially the last quarter is not bad, and also next year as well.
Does one need a vaccination passport to visit Kenya?
Say that again.
I was just saying, does one need a vaccination passport to visit Kenya?
We have not yet got to that stage. Currently, we are still using PCR, which means that you need to get a PCR negative test 96 hours before you come to Kenya. But in the immediate term, in fact, this is a proposal we've made across, and our government is considering it seriously. Anybody who's had the double vaccine full dose, they should be able to come to Kenya even without a PCR. That is a proposal we've made, but at the end of the day, it has also to be reciprocal. There has to be reciprocity, which means that, for instance, South Africa, if you are coming to Kenya and we recognize your vaccine certificate or vaccine passport, the same thing then should apply to a Kenyan who is visiting South Africa. And this is one of the things that the UK government is currently doing with our government. We are hopeful that they should be able to come to some sort of an agreement that anybody visiting the other, as long as you have the full dose, then it means that you're fully covered and you are spared quarantine and you're also spared a PCR testing. So we are getting there, and we are confident that we should, our government and working with other government should be able to come to some form of agreement, because that's very crucial if tourism is to reopen.
Which countries traditionally have been your biggest visitors, and have they started to come back?
The biggest source of market for us has always been the US. then Germany and UK. US, I'll tell you, they've started coming back big time. Number one, thanks to the new administration in America, who have gone full blast to get Americans to be vaccinated. When you get close to 300 million people getting vaccinated, that is not a joke, and that is very good. So a lot of them are actually coming back, and many of them are asking, and the agents are asking, can we get a driver guide? Can we get a hotel where most of the staff have been vaccinated? And the answer is yes, because our government has come out very strongly to give us that. We are targeting close to 50,000 of our staff who are going to be fully vaccinated. And that gives us a lot of, a lot of comfort that we are able to go back to the source market and tell them these are the stuff that we have done. And let me tell you, a lot of them, when the few who have come in, the reviews they're giving is also helping us a great deal for us to get that repeat business and specifically to give that reassurance to anybody who is planning to visit Kenya. And so far, it has been good, and we're quite happy with the response. India, for instance, has also been another source market for us, and we just reopened up the other day after they were also put on some red list on the Kenyan side, and a lot of them have started coming in, and of course, we still require PCR test, but when all this put together, we believe that numbers will start going up. We are confident of that.
Mohamed, Hersi, we're going to have to leave it there. Thank you very, very much indeed for joining us and sharing your thoughts with us on the program. Thank you for your time.
Thank you.
All right, now there's a man who understands tourism and travel and talking to us about what's happening in East Africa, particularly in Kenya, that seems to be seeing a rebound, but certainly a lot of work still to be done.